The subject of our matter today is fibroid embolization. And the first question obviously will be, what is fibroid embolization? This is a new innovative procedure that allows the doctors to treat the symptoms of young ladies who have fibroids. Who has fibroids? Fibroids occur in young ladies who are in the reproductive years of their lives, that are people who are still able to conceive or bear children. Now, much as this may be unknown to most people, fibroids occur for a number of reasons. Firstly, the majority of people, we may not have a reason why they have fibroids, but it has been known that with the advent of smaller families, more people are now presenting with fibroids. What are they? They are just muscular outgrowths, and these lumps that we're talking about that are called fibroids tend to have a lot of vessels within them, so much so that they cause a lot of bleeding. So what are the symptoms of fibroids? The symptoms include, 1, pain, which is severe and may be related to your periods. Secondly, the patients have what we call menorrhagia. These are patients who are going to have very heavy bleeding in and around their periods. Thirdly, we now have pressure symptoms. That means because the uterus is so big now, it is pressing on the other organs within the pelvis. For example, it will press on your urinary bladder, so much so that the bladder doesn't feel as it used to feel before. For example, you may have a bladder that used to take, for example, 600 mils. It can only take 200 mils. What is the result? The patient has to go too often to the toilet, and sometimes they wake up at night and they have urgency as well. The pressure is also experienced at the back, where patients may be constipated. We did talk a little bit about the presence of pain, and this may be related to the pressure that we have, but also the presence of the fibroids on themselves. Resultantly, secondary to that is that when you bleed a lot, you're going to have symptoms related to loss of blood, like weakness and similar related symptoms, which can be aggravated to a point where you have cardiac failure. What has been the treatment of this fibroid in the past? In the past, 2 major treatments were advised. Firstly, the patient would have her uterus removed. It's called a hysterectomy. This may be pleasant or desired in ladies who are in the latter part of their lives, that is, those who are about 50 or so, who may not want to have a uterus in. But for a young lady who still has a life ahead of her, it may not be a desirable thing. She may want to change her mind at some point and have a baby. So hysterectomy may not be the best thing. The second treatment is called a process where you remove these fibroids individually, one by one, and they are then sent to the lab for confirmation that they are fibroids. Unfortunately, this last procedure that we talk about has a problem in that it then causes the fibroids to come back again. That is, it is not definitive, it is not final. Patients don't stay even for 6 months and the fibroids have started growing back again. Now, the new method which we are proposing is called fibroid embolization. What is fibroid embolization? A small catheter is inserted into one of the arteries, which will descend into the uterine artery, and we block the blood supply to the fibroids. This procedure then causes the fibroids to die, and they never come back. In Europe and the Americas, this has become a very popular option for ladies, and it has become mandatory that the specialists and the general practitioners have to offer this as an option to patients. Unfortunately, in Africa, we tend to be a little on the slower side, and we haven't reached that point. So much so that a lot of ladies are still losing their uteruses. There will be a video attached to this one that explains in more detail how this procedure is performed, and you'll find this attached at the bottom of the screen. Thank you.